So yeah, hello everyone. So we'll start with the 25 MCQs. So yeah, the first MCQ is pain relief in acupuncture is by substance P, endorphin, serotonin or histamine. So I will repeat the question once again. The question here is pain relief in acupuncture is by substance P, endorphin, serotonin or histamine. So yeah, if anyone knows the answer, you can tell. What is the pain relief in acupuncture is by substance P, endorphin, serotonin or histamine? Anyone was line? Okay, the answer here is anyone? Yeah, the answer here is endorphins. So in acupuncture, what they do, they will stimulate the spinal cord as well as the brain, and they will release opioids, that is the endorphins they will release, so that pain relief will be there in acupuncture. That's why. So it is pain relief in acupuncture is by endorphins. Next we have the porphyrin present in heme is, and the options are protoporphyrin, uroporphyrin, coproporphyrin or benzoporphyrin. So I'll repeat, the porphyrin present in heme is protoporphyrin, uroporphyrin, coproporphyrin or it's benzoporphyrin. So yeah, if anyone wants to answer this, it's a biochemistry question. The porphyrin present in the heme is, okay, the answer, if anyone, okay, the answer here is, it's A, right? As you have to remember that it's actually protoporphyrin and heme. And what is heme, you all know, it's a part of the hemoglobin and all that, I don't need to tell. But yeah, okay, you have to remember protoporphyrin is present in heme. Yeah, next question we have, as a medical officer of a community health camp, what is the drug of choice that will be prescribed under the safe strategy for trachoma management? So yeah, the options are erythromycin, tetracycline, doxycycline or penicillin. So I will repeat, it's as a medical officer of a community health camp, what is the drug of choice that you will prescribe under the safe strategy for trachoma management? Erythromycin, tetracycline, doxycycline or penicillin. So yeah, I will repeat the question if you want. It's as a medical officer of a community health camp, what is the drug of choice that you will prescribe under the safe strategy for trachoma management? That is erythromycin, tetracycline, doxycycline or penicillin. Anyone wants to answer this? Under the trachoma. Okay, I will tell. The answer here is first, that is A is the right answer. Erythromycin is the right answer. That is given at the dose they have given, that is 1 gram, while 20 mg per kg body weight is given for children. So basically 1 gram is given for adult. That is the safe strategy for trachoma management. So oral erythromycin is the right answer. Next question we have, which of the following are not true regarding external hemorrhoids? And what they have given is painful, self-curing, banding is preferred, covered by squamous epithelium, commonly located at 3, 7 and 11 o'clock position in the anal canal. So I repeat, which of the following are not true regarding external hemorrhoids? Painful, self-curing, banding is preferred, covered by squamous epithelium, or commonly located at 3, 7, 11 o'clock position in the anal canal. So yeah, okay, I'll repeat the question. Which of the following are not true regarding the external hemorrhoids? That is painful, self-curing, banding is preferred, covered by squamous epithelium, or it is commonly located at 3, 7, 11 position in the anal canal. So which of the following is right answer if you know the answer? Otherwise I will tell. True regarding the external hemorrhoids, here will be 3 and 5 is the right answer. And what is 3? Banding is preferred. And what is 5? That is, it is commonly located at 3, 7 and 11 o'clock position in the anal canal. Yeah, third, yes, C is 3 and 5 both. 3 and 5 both is the right answer. And you all know what is hemorrhoid. Basically, it's you can say it's a painful, self-curing, covered by squamous epithelium and all that. And banding is preferred for internal hemorrhoids. And we are talking about external hemorrhoids. So yeah, 3 and 5 is the right answer. Next question we have, a 45-year-old man presents with you with recurrent episodes of headache, palpitation and sweating. His BP is 180 by 100, and further whatever you test you do, it's coming elevated urinary metanephrines. CT abdomen shows a right adrenal mass. What is the drug of choice for the management of this patient? I will repeat once again. It's a 45-year-old man with recurrent episodes of headache, palpitation, sweating. BP is 180 by 100, and there is elevated urinary metanephrin and CT scan shows right adrenal mass. So what is drug of choice for this patient? And the options are labetalol, nitroprusside, phenoxybenzamin or phentolamine. Labetalol, nitroprusside, phenoxybenzamin or phentolamine. Anyone? For similar diagnosis, what you got with all that? BP is high, headache is there, palpitation, sweating is there. Basically, you have to know what is urinary metanephrin, which has been shown here. Anyone? No, labetalol we don't. Labetalol is, it's an anti-hypertensive drug, but we don't give here because we have to diagnose the patient first, not just symptomatic treatment or BP is high. So the scenario, basically clinical scenario is pheochromocytomia because it has all. Headache will be there, palpitation, sweating, BP is high, and the most important, that is urinary metanephrin will be present in pheochromocytoma. So what is drug of choice for pheochromocytoma? If you know, it is C, that is phenoxybenzamin. And what we give drug of choice to control BP before surgery is called phenoxybenzamin. It is a non-specific alpha blocker and preferred for its long action. So it's phenoxybenzamin is the right answer. Next we have, which chromosome contains the gene that determine the A and B blood group? 9, 7, 5 and 1. So if you know the chromosome number, then only you will know. I will repeat, which chromosome contains the gene that determines the A and B blood group? Options are 9, 7, 5 and 1. Anyone wants to try at least? A and B blood groups, which chromosome will be there? 9, 7, 5 or 1? Okay, the answer here is, that is the first one is the answer, that is 9. So 9th chromosome will be present in the A and B blood group systems. A and B blood groups, yeah. Chromosome contains the gene that determine A and B blood group, that is 9 is the right answer. Next we have 7, no, it's 9 you have to remember. Next we have, while performing total thyroidectomy, a nerve coursing along the superior thyroid artery is injured. Which of the following is a probable consequence? I repeat, while you are performing a total thyroidectomy, a nerve coursing along the superior thyroid artery is injured. Which of the following is probable consequence of this? And the options are loss of sensation above the vocal cords, loss of sensation below the vocal cords, paralysis of the lateral cricoarytenoid muscle or paralysis of the cricothyroid muscle. So basically you have to know what is the nerve first, which will come after the thyroid surgery. Anyone? The nerve which is closely related to the superior thyroid artery. If anyone can tell that, you can easily tell all this then. The nerve which is around the external thyroid artery. Okay, the answer, I will tell the nerve first. The nerve here is external laryngeal nerve. So in external laryngeal nerve, what will happen? The options are loss of sensation above the vocal cord, loss of sensation below the vocal cord, paralysis of lateral cricoarytenoid muscle or paralysis of cricothyroid muscle. So what will be the answer? Okay, I will only tell the answer there is D, that is the paralysis cricothyroid muscle. Because what I told, it's external laryngeal nerve which is there in that area, because injury of external laryngeal nerve will cause this cricothyroid muscle paralysis. It is the main tensor of the vocal cord, and paralysis of this muscle leads to decreased pitch of the voice. So we have to remember this. There is an external laryngeal nerve which comes along the way of superior thyroid artery. Next we have, what is the most common site of vulval cancer? The options are clitoris, labia majora, labia minora, perineal areas. I will repeat, what is the most common site of vulval cancers? Clitoris, labia majora, labia minora or perineal area? Anyone? At least try A, B, C or D. Okay, the answer, no one wants to try. The answer here is B, that is labia majora is the most common for vulval cancers. Most common site for vulval cancers, and it is labia majora, then clitoris, then labia minora. Yeah, labia majora is the right answer. So it is the most common site for vulval cancer. Next we have a 24-year-old woman comes to you who presents with aquagenic pruritus and HB is 20 gram per TL. On further evaluation, she has found positive for JAK2 mutation. So which of the following is not seen in this condition? And the options are autonomous clonal erythrocytosis, Budd-Chiari syndrome, myelofibrosis, or it's an increased erythropoietin level. So it's a 24-year-old woman and she has an aquagenic pruritus. HB is 20 gram per DL and she has positive for JAK2 mutation. So which is not seen? Autonomous clonal erythrocytosis, but CRE, myelofibrosis, or increased erythropoietin level. So anyone which is not seen in this, you have to know what is JAK2 mutation and it occurs where. What is the diagnosis first, if you can tell? Okay, the diagnosis I will tell. See, HB is 20, that is HB is high. So diagnosis will be polycythemia will be there. A. No, A is not the answer, it's D, that is increased erythropoietin level is the answer. So yeah, what I was saying, the diagnosis here is polycythemia vera, because hemoglobin is already 20 gram per TL. And JAK2 will be associated with polycythemia vera, that you have to remember. So yeah, if you have a polycythemia vera, erythropoietin level will be, it's a normal or decreased. So here it will be, what is not seen is increased erythropoietin level will not be seen, because it's a polycythemia vera and it will be decreased erythropoietin level. Already it is high, so erythropoietin will not act in this condition. So myelofibrosis, but CRE, and autonomous clonal erythrocytosis, it's not. Okay. Next we have you have been requested to inspect the working condition of an office for clerks. What is the standard illumination recommended for such a space? It's a PSM question. If you know, just what is the standard illumination recommended for such a space like it's an office? So it's 100 lux, 1100 lux, 900 lux, or 400 lux. You have to remember this. If you don't know, you won't be able to tell. Standard illumination recommendation for such a office area: 100, 1100, 900, or 400. So yeah, I don't think you will be knowing. The answer here is D, that is 400 lux is the right answer. For a general office area, you will have 400 lux, and for normal, what we do, casual reading we do, that is 100 lux is required. And general office work, what was the question? It is 400. And yeah, that's it. Next we have which of the following is not a criteria for beta-quilin conditional access program under RNTCP? I'll repeat, which of the following is not a criteria for beta-quilin conditional access program under RNTCP? And the options are: patient below 18 years can be included, postmenopausal females can be included, patients with stable control arrhythmia can be included, or pregnant patients are excluded. So I will repeat the question: which of the following is not a criteria for the beta-quilin conditional access program under RNTCP? And the options here are: patient below 18 years can be included, postmenopausal females can be included, patients with stable control arrhythmia can be included, and pregnant patients are excluded. So if you can try this. Okay, I will only tell the answer. The answer here is A, that is patient below 18 years can be included. So basically it's not a criteria for RNTCP. And others, what I call, that is the postmenopausal females can be included, whereas pregnant women are excluded. Yeah, A is the right answer. And pregnant patients are excluded, patients with stable control arrhythmias can be included. Basically it's a PSM question. So in PSM you have to remember, there is no choice for you. So under the beta-quilin conditional access program, what they have given is age is greater than 18 years should be there. Females with non-hormone based contraceptive or postmenopausal females can be included, and patients with controlled stable cardiac arrhythmias can be considered, and pregnant women to be excluded. So next question we have: middle-aged woman underwent a through-cut biopsy for suspicion of malignancy on a mammogram. Microscopy showed the presence of an invasive breast carcinoma, and IHC staining of the tumor is given below. And which of the following drugs will you add along with chemotherapeutic agents for treating this patient? First, you have to know the diagnosis. See, they have given IHC staining. In IHC staining, they have given, it is ER positive, PR positive, and HER negative. So you have to remember that. See, leave that immunochemistry. Leave that. Just remember, its question is middle-aged woman. Through-cut biopsy was done for a malignancy on a mammogram. Microscopy showed there is an invasive breast carcinoma. And what will you add along with chemotherapeutic agents for treating this patient? And the options are tamoxifen plus trastuzumab, fulvestrant, or palbociclib. So I repeat, it's tamoxifen plus trastuzumab, fulvestrant, or palbociclib. Anyone? What you will give? See, ER, PR, and HER, all three are positive, and it's a case of IBC, that is invasive breast carcinoma. You can try. Okay, the answer here is B, that is tamoxifen plus trastuzumab we have to give as a chemotherapeutic agent. Chemotherapy along with endocrine therapy, and trastuzumab is an adjuvant therapy for treatment of choice. So you have to remember this. That is a triple positive or luminal B, and chemotherapy with tamoxifen and trastuzumab we have to give. So there is no choice for it. Next question, yeah, it's I think we'll get this. It's a OBG question. Out of 100 women who took oral contraceptive pills for contraception, 10 women got pregnant within 24 months. So what is the Pearl index? You have to know the formula for Pearl index, and the options are 10, 5, 15 or 20 per HWY. So out of 100 women who took oral contraceptive pill for contraception, okay. See, out of 100 women who took oral contraceptive pills for contraception, 10 women got pregnant within 24 months. So what is the Pearl index? And the options are 10, 5, 15 or 20. So basically you have to know the Pearl index for this. Anyone knows what is the Pearl index? Okay, the Pearl index is basically that is the total accidental pregnancy by total months of exposure into 1200. So in that you have to put this formula. So here what they have given is 100 women, 10 women got pregnant within 24 hours. So what is the Pearl index? So anyone wants to try with the formula? And this Pearl index is total accidental pregnancies by total months of exposure into 1200. So it will be like, see, it's 10 women got pregnant. It will be 10 by 24 into 1200. So yeah, in that way you can 10 by 24 into 1200. What is the answer? 5 is the right answer. So yeah, I think I am going slow. So yeah, Pearl index is total accidental pregnancy by total months of exposure into 1200. You have to remember this. Next we have a child presents with diarrhea, weight loss and abdominal pain. His mother reports stools to be greasy and foul smelling. A wet preparation of the stool sample is shown below. What is the first line therapy for this condition? So I will tell what is they have given. See, that they have given, it's a wet preparation of the stool sample is given to us, and it's Giardia lamblia. Yeah, it's a case of Giardia lamblia. So anyone knows what is the drug of choice for Giardia lamblia? Well, otherwise you won't be tell. I will just tell the symptoms again. It's diarrhea, weight loss, abdominal pain is given, and his mother reports stools to be greasy and foul smelling, and the wet preparation shows it's Giardia lamblia. So what is the first line therapy for Giardia lamblia? You have to answer that. So options are tinidazole, metronidazole, albendazole or mebendazole. It's tinidazole, metronidazole, albendazole or mebendazole. Anyone? What is the treatment of choice for giardiasis? Okay, I will tell you, it's metronidazole is a drug of choice for giardiasis, the Giardia lamblia, that is caused by Giardia lamblia. So what we give, it's a metronidazole 250 to 500 mg TID we give totally for 7 days. So you have to remember a dose as well as what is the drug of choice for giardiasis, that is metronidazole, and it's 250 to 500 mg TID orally for 7 days. Next question we have, a patient is administered drug H that follows first order kinetics. 40 mg intravenous dose results in a plasma concentration of 2 mg per liter initially and 1 mg per liter 4 hours later. So what is the clearance of the drug X? And the options are 5, 10, 3.5 and 7 liter per hour. So I will repeat, it's a basically biochemistry question. Again here I have to know what is the formula for clearance. So I will repeat again, it's a patient is administered a drug that is H they have given. It follows first order kinetics, and 40 mg intravenous dose results in a plasma concentration of 2 mg per liter initially and 1 mg per liter 4 hours later. So what is the clearance of this drug? 5, 10, 3.5 or 7? At least guess if you don't know the formula for this. You can guess at least what is the formula. Okay, see, I will tell. See, there is volume. See, it's a difficult again. Okay, clearance is 0.693 into VD by T half, that is the half-life of that period. So basically volume distribution, what is VD? First you have to know what is VD here. Volume distribution is amount of drug in the body by initial plasma concentration. So amount of drug in the body is what? it's 40 and it's 40 by 2, that is 40 by 2 is 20. Then 20 we have 0.693 into 20 by t half is 4 hours. So basically it's around 3.5 liter per hour. Actually I don't like this question, but it comes in the exam, no option. So yeah, the next question we have: an unmarried woman had consensual sexual intercourse with the wife of his friend. So his friend found about the affair and filed an FIR against the man. Under which of the following IPC can the man be booked? IPC 420, that is cheating; IPC 354A, that is sexual harassment; IPC 497, adultery, or none of the above. So I will repeat. Here there is an unmarried man who had a consensual sexual intercourse with the wife of his friend. His friend found about the affair and filed an FIR against the man. Under which of the following IPC would you consider as? IPC 420, cheating; IPC 354A, sexual harassment; IPC 497, adultery, or none of the above. So I will wait for the answer. If at least try what is the IPC 420, 354, 497. Okay. Now if you know the answer, it will be very... Okay, the answer here is none of the above. I know you are thinking any above, but the answer is none of the above. None of the above IPC are considered for this, and it's basically section 497. Section 497 is the right answer for this condition. Basically, adultery is not liable for criminal prosecution. Section 497 for IPC dealing with adultery was invalidated by the Honorable Supreme Court on 27 December 2018. Therefore, however, there might be civil liabilities. So yeah, it's a section 497 is the right answer for this. It is not liable, yeah. So it was there for adultery, but now adultery is not considered to be a part of. Okay, the next question, there is the image we have given. Yeah. Patient comes to you with hair loss as shown below. How will you classify its severity? So basically the image they have given, how can I tell the... Really, okay, it's a female patient and they have given it's a female pattern hair loss with frontoparietal thinning and maintenance of the frontal hairline. So what is the staging? What is the staging you do for a female pattern hair loss? The options are Tanner staging, Hamilton-Norwood staging, Batch-Lovett staging, or Ludwig staging. Anyone want to answer this? It's a female pattern hair loss with frontoparietal thinning and maintenance of the frontal hairline, and it's which staging we have to do. That is Tanner staging, Hamilton-Norwood staging, Batch-Ludwig staging, or Ludwig staging. I think you won't know the answer. It's a Ludwig staging. That is the fourth one is the right answer. That is for female pattern hair loss, it is done with Ludwig staging. We have to remember that. And Hamilton-Norwood was the option was given. It's for male pattern hair loss. Tanner staging is for basically assessing the sexual maturity, and Batch-Ludwig staging is used for staging chronic hepatitis. Tegelen staging, Tanner, no, Tegelen, I think you are telling about Tanner staging, but Tanner is used to assess sexual maturity and not in this case. For female pattern, we have Ludwig staging for female pattern of hair loss. And what I told, Hamilton is for male pattern, Tanner is for sexual maturity, and Batch-Ludwig staging is for chronic hepatitis. Then next we have, it's a 55-year-old man who was brought to the OPD with complaints of rapid decline in cognition, impaired position, and vibratory sense. There is a history of sporadic short-term relationships with many promiscuous sexual partners. Romberg sign is positive, and bilateral Ergel-Robertson pupils are seen on checking for the pupillary reflex. Which of the following is the investigation of choice? Basically, I would first diagnose, then I will tell. Yeah, because I will repeat, it's a 55-year-old man, rapid decline in cognition and impaired position and vibratory sense. There is a history of sexual intercourse, you can tell, the multiple partners. And the Romberg sign is positive, and bilateral Ergel-Robertson pupils are seen on checking the pupillary reflex. So what is your diagnosis if you can tell with this scenario? With the option you can tell easily. The options say which of the following is the investigation of choice, and the options are treponema pallidum hemagglutination test, VDRI test, fluorescent treponema antibody absorption test, that is then EIA, that is enzyme linked immunoassays. We have done this question before also. You might not be there, but we have done this question. Basically, the the what they have given sexual intercourse multiple partners in there and all that, numbers and positive and all that, and they have given, it goes to a neurosyphilis. And now you can tell at least what is the investigation of choice for neurosyphilis. If you can try at least, it's Treponema pallidum hemoludation test, Beneral VTRL, producing treponemal antibody test, और यही है. So what is the investigation choice for neurosyphilis? Okay, I will only tell it's a VDRL test. We have discussed before also, it's a VDRL test is the investigation choice for neurosyphilis. And Robertson pupils and bilateral, that is not only bilateral aggregate Robertson pupils will be seen and the Romberg sign will be positive in these patients. Next we have which subtype of acute, that is which subtype of AML presents with disseminated intravascular coagulation as a paraneoplastic manifestation. And the options are AML minimally differentiated, acute promyelocytic leukemia, acute myelomonocytic leukemia, or acute megakaryocytic leukemia. A TP antigen, no, it's a VDRL test. If you're talking about that, no, yeah, it's a VDRL test is the investigation of choice for neurosyphilis. And what I was telling here is which subtype of AML presents with disseminated intravascular coagulation as a paraneoplastic manifestation. And the options are AML minimally differentiated, acute promyelocytic leukemia, acute myelomonocytic leukemia, or acute megakaryocytic leukemia. If you can tell this, I hope my sound is clear and I'm slow this time. Yeah. Okay, the answer here is anyone? Okay, the answer here is B, that is acute promyelocytic leukemia is considered with disseminated intravascular coagulation as a paraneoplastic manifestation. So you have to remember it's basically commonly associated with acute promyelocytic leukemia and prostatic adenocarcinoma. So DIC is considered associated with APL and prostatic adenocarcinoma. Next we have this, I think you will, if you know the answer, okay, you will know. See, the next question is water content of soda lime is 0, 5, 10, 15. This at least you can guess what is the water content of soda lime. 0, yeah, promyelocytic leukemia. So yeah, what is the water content of soda lime? 0, 5, 10 or 15. Anyone can tell? At least try. Water content of soda lime. Soda lime we use in anesthesia, you might be knowing that much. Okay, the answer here is D, that is 15% water content is present in soda lime. You have to remember, see, soda lime is basically CaOH, that you know, basically calcium hydroxide 80% will be there, NaOH 3%, KOH 2%, silica 0.2 and moisture that time was 14 or 19%. So yeah, it is 15% they have given it already. So yeah, it's water content in soda lime is 15%. Okay, 15 or 20%, yeah, 15 it's the right answer. Next we have what is the ideal ratio of compression to ventilation that you would use in resuscitation of a newborn. 30:2, 5:1, 3:1 or 2:1. This, it's a basically emergency question, I know better emergency. So what is the ideal ratio of compression to ventilation that you would give for resuscitation of a newborn? 30:2, 5:1, 3:1 or 2:1. Anyone wants to try this answer? It's for a newborn, resuscitation of a newborn. Compression is to ventilation ratio 30:2, 5:1, 3:1 or 2:1. What is the ratio for this? Okay, the answer here is, if no one wants, okay, the answer here is, anyone? Okay, it's 3:1 is the ratio. We give actually 90 compression we give and parallelly we give 30 breaths in 1 minute. So 3:1 compression ratio for neonatal resuscitation we give. So yeah, 3:1 is the right answer for this. Next we have a worried mother brings her febrile infant to the emergency room. He is kind, unnecessary and clutching his ears. He had the following finding on otoscopy. What is the most likely organism implicated in this condition? So actually it's a ENT question, and what they have given, it's basically a febrile infant is there and is crying and clutching his ear. So which are had the following on otoscopy, not autopsy. So yeah, basically you will see in otoscopy you will see there is a congested tympanic membrane with purulent effusion is there. So basically, what will you consider it's and what is a causative agent? Beta hemolytic streptococcus pneumonia, Haemophilus influenza, staphylococcus. So first tell me what is the diagnosis here. See, if you have a tympanic membrane that is congested and history is a child, congested tympanic membrane, and you have a pool and discharge from coming out, and it's a acute, it's a acute and with fever. So what is the diagnosis with this? Okay, I will tell the diagnosis here is ASOM. And in ASM, what will be basically most common is streptococcus pneumonia is the right answer. That is B is the right answer here. Okay, yeah, the most common what I told is streptococcus pneumonia for ASM in infants and young children. And yeah, that's it. Acute rhinitis media, ASM is there. Next we have which of the following modalities are used for diagnosis of placenta accreta? USG, MRI, angiography or X-ray. It's a multiple choice question and I will repeat. Which of the modalities are used for diagnosis of placenta accreta? USG, MRI, angiography or X-ray. So it's a multiple choice. Now you can tell. USG, MRI, angiography or X-ray. So I think angiography we don't use. Maybe, but what I think is... Yeah, I think anyone can tell. My answer is also right. So which of the following modalities are used for diagnosis of placenta accreta? Options are ultrasound, MRI, angiography or X-ray. It's a multiple choice. You have to tell anything. More than one is the right answer. Okay, before you tell the answer, then I will tell what is placenta accreta and what they have given. Placenta accreta is basically it's a condition in which placenta is directly attached to the myometrium, either partially or completely without any intervening decidua. This is due to the absence of decidua basalis and poor developmental of fibrinoid layer. So risk factors are prior cesarean delivery, prior uterine surgery, prior curettage, endometrial ablation or associated placenta previa. So yeah, USG is right answer. It's a multiple choice, I told you already. So the answer here is USG and MRI both, because angiography and X-ray you don't do in placenta accreta. So the answer here is 1 and 2 is the right answer. And I already told what is placenta accreta. It's placenta directly attached to the myometrium, partially or completely without any intervening decidua is not there basically. Next we have which of the following is true regarding corads. So corads you might be knowing in COVID. So corads, COVID-19 reporting and data system. So which of the following is true regarding corads? So the options are corads 0 indicates normal length, corads 5 is typical of COVID-19, pleural thickening is typical of COVID-19, and lobar consolidation is typical of COVID-19. So basically the question is what is true about the corads, and you might be knowing in COVID corads since we have seen. So what is true regarding the corads? It's corad 0 indicates a normal length, corad 5 is typical of COVID-19, pleural thickening is typical of COVID-19, or lobar consolidation is typical of COVID-19. So if you can answer, because you might be working in COVID. So which is right? Okay, I will tell the answer. The answer there is B, that is corad 5 is typical of COVID-19. Because you know it's from corad is from 0 to 6 here. It is 0 to 6, and typical is for COVID-19 is corad 5. And see, 0 is corad 0 indicates normal lung is the wrong answer, because corad 0 basically it's that is scans are incomplete or of inferior quality. I will tell all the ones. Once corad 0 is scans are incomplete or inferior quality. Corad 1 is normal. Corad 1 normal or non-infectious. Corad 2 typical features are there, but is not COVID-19. Corad 3 is features compatible with COVID-19 but also with other disease, and corad 4 is suspicious of COVID-19, and corad 5 is typical of COVID-19, and corad 6 is proven COVID-19 by positive RT-PCR test. Next we have, which is the last question for today, which of the following ligaments is most commonly injured in ankle sprains? Options are deltoid, spring, anterior talofibular, medial talofibular. It's an easy question, or guess at least. It's the last question, you can guess. Which of the following ligament is most commonly injured in the ankle sprain? Deltoid ligament, sprain ligament, anterior talofibular ligament, or medial talofibular ligament? Anyone? Okay, I will only tell the answer if you don't want. It's anterior talofibular ligament. It's the most commonly injured in the ankle sprains. So what is ankle sprain? Most commonly you all know it's a sport injury, and also due to excessive loading of the joint when the ankle is in inversion and plantar flexion. So here the answer is anterior talofibular ligament is most commonly injured in ankle sprains. So yeah, it's for today it's over. And last question I got over. So yeah, thank you so much.